Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being.
Welcome to Redefining Medicine. And there's nobody who redefines medicine more than Dr. O'Hara. And that's because Dr. O'Hara has been taking care of kids with autism before she was even a physician. Then she became a pediatrician and focusing on kids with special needs, and is now the author of this amazing book, Demystifying PANDAS. And I'm very fortunate to have Dr. O'Hara with us today. So thank you for joining us, Dr. O'Hara. So tell me about it.
Well, this is, I think, my second baby. The labor of this one took a lot longer than my first, but you know, I started my career, as you said, teaching children with autism, and then took the easier road and went to medical school, and worked with children with special needs for the last over 25 years. And when my son was 10, he developed sudden onset of tics. Seizure-like tics, would be sitting in a chair like this and ending up on the floor looking like he had a seizure. And it was within a week of getting a strep infection, getting bit by a Lyme-positive tick, and getting a viral infection. And that's when I learned about PANS and PANDAS. And thankfully, because of the career I was in, I threw the kitchen sink at him, and he got better. But that started my road. And now we have a practice where the waiting list is 6 months, and when you have a sudden onset of a disease that does better if you treat it rapidly, waiting 6 months is untenable. So at the beginning of COVID, I actually started writing this book, and to try to get more practitioners to believe in it, to understand it, and to treat it effectively in a functional medicine way. Not just with antibiotics and IVIG and plasmapheresis, which is great for some of our kids, but with all the nutraceuticals and dietary and lifestyle changes that we know work.
So how did you get the doctors to start hearing you? Sorry.
I'll let you know when it happens.
You're right. I knew I was asking the wrong question there.
I think, you know, whether it's doctors or families, it just starts with one child. It always does. And what I find is if one of the children in a pediatrician's or family practitioner's practice gets better after seeing us, then they develop some interest. And often then I'll have a mentoring session or a discussion with them, and they may be more willing to look at it for the next child and be more willing to do that. And it's great to happen on a one-on-one basis, but why I wrote this was to try to do that for more people, or to be able to give parents a book with 498 references, so doctors may take it a little bit more seriously, but to be able to take and say, hey, I think this is what my child has.
So give me an example. You know, it's always amazing to hear the stories because everybody has a personal story, and you started with your son, which is an unbelievable story. And actually makes sense because you were working with autistic kids already, so this was like, you were the right person that was chosen to do this, to get there, right? So give me examples of who comes to you now and how do they get to you instead of staying stuck in the system?
Right. You know, as we said, my practice started 25 years ago with children with autism, so we still have a large percentage of children in our practice with autism. But now well over 60% are children with PANS, PANDAS, chronic Lyme, chronic mold disease, et cetera. And for the most part in the past 30 years, it's been word of mouth. It's been one child to another, one family, you know, just like that. But I've reworked with, again, much painstaking, you know, because I'm not a technological person, reworked our website. And so if they are interested, they can go to our website, which is just drohara.com, and find out more information there just about our clinic, the other wonderful practitioners I have. We have dietitian, therapists, a couple amazing naturopaths, and myself. And then also the membership program to watch videos online and mentoring and the whole 9 yards.
So when somebody's really interested, they'll get it. So now the difference becomes between the families and the conventional training. So how often do you get to environments like here where the doctors actually care, the providers are really interested in functional medicine and alternative ways of doing things, where actually medicine is going? How often do you do this, and what do you teach the doctors? Give them a little brief synopsis of it.
This week,
Yes.
2 conferences, and both the first in person in 2.5 years for me. But we also do lots of webinars, online training, and some live Q&As, and hope to provide that really for all practitioners, MDs, DOs, naturopaths, chiropractors, and I think in the next 3 months we have about 12 of those set up, and again, information for doctors on our website with the events that are coming up, and just, it takes a village with all of our kids.
Sure does.
And it's important for I think MDs especially, to realize that and to utilize that, so we, in addition to what I do, utilize those other people to help train all of the people in a doctor's office.
I agree. I couldn't agree with you more, and I find it really interesting that pediatrics is the last of the fields of medicine that's really getting to the integrative, complementary, functional, whatever you want to call it, where they actually look at people's lives as a continuum of health rather than diagnosing a disease.
Exactly.
And it's amazing to have you actually take on the responsibility of doing something like this. And today, seeing in Redefining Medicine at A4M, it's amazing to see that there is a whole track that's all about pediatrics. So how long did you wait for that one?
When I started my career in medicine, I was a partner in a general pediatric practice.
Oh, that must have been fun.
I tried so hard as I was, because I came to this then through infertility.
Interesting.
I had taught children with autism, so I had a lot of children with autism in the practice, and I had one little boy who got better with dietary changes. He was 4.5, and it was a fortuitous way that it happened, but he started speaking for the first time. And his mom found my mentor, Dr. Sidney Baker, who we all know is one of the grandfathers of functional medicine. And at that time, I was like, diet, change behavior, diet. But I had been let down by the allopathic community in trying to reach fertility. And I thought, well, I'll go as a patient. And that changed my life. And then I tried to integrate it into a general practice, and it just didn't work. A week before I left, they said I was spending too much time with patients and a couple other things. But, it does take time. And I think pediatrics, unfortunately, has become and almost needs to be a volume business. And when that is happening, you can't do it alone as an MD, and that's why I say it takes a village. I'd like to see our pediatricians involve more dietitians or naturopath or health counselors or health coaches into their practice to help our families, and also get to the OBs.
Right.
Because as we learn in pediatrics, the first 1,000 days of life start well before conception even.
Right.
And we have to impact all of these families and children to help them be healthier.
Indeed. So the problem really becomes, how do you get to these people? How do you get a doctor or a provider who's allopathically trained or traditionally trained, shall we say, to start thinking that diet will affect outcome, that exercise will affect outcome, that fresh air will affect outcome, that sleep will affect outcome. How do you get to that? And how do you get to that with children? Because what I see, because I'm at the other end of it, I'm at the adult end of it, what I see is that people treat their children like it doesn't matter. You'll need your hormones when you get older. You'll need your peptides when you get older. But that's not true. No. Your supplements, the fetus is in utero.
Right.
So How do you change that? How do you start with pediatrics? How do you get people to understand that the moment they put something in their mouth, it affected them?
And I think a lot of times it's a hook.
Okay.
It's one thing. I talk about literature on vitamin D, whether it be in COVID or mood or autoimmune disease, and just see the difference in that one child. I talk a lot about dietary changes just with dairy, removing dairy in those children with chronic ear infections or allergies or congestion. And I think, again, with seeing that as a pediatrician, then there may be that just little step in that direction. And I think it's trying to provide those studies and really providing the studies with not the sound bites that are not actually giving the information that's in the study, but the sound bites that talk about what's really happening, like the vitamin D study in COVID, like the studies of gluten-free diets that show the difference in zonulin levels, and looking at the studies in the microbiome, because I think they need that. They need to see it, that there's evidence-based research in this way, but then see it from the family, bringing in the one study, this helped my kid, and then showing that to them, maybe I'll believe that. So we'll see.
Well, we'll see. You're seeing already.
Absolutely.
Look, you're looking at your product and look at the children. Your 6 months wait is really a very impressive thing. Yeah. So what do you do with those kids? Because they can't wait 6 months.
Right.
So what do you do with them? Do you train doctors? Do you train providers to take them over?
That's what this is really about, is training doctors, providing ways that they want to learn. So in a busy pediatric practice, what we're providing is 2 to 3 minute videos where they can watch how to do a physical exam to figure out if a child has PANS and PANDAS, how to do and get the appropriate lab tests, and then how to read them, how to look at what the infectious are and what things they are to do, providing a mentoring program with all of the people in our practice to help them, provide a case that we may be able to help them with. And then I'm actively looking for continuing to grow the people in our practice, because even with 2 more colleagues in the practice, we still haven't decreased that waiting list. So we're keeping looking for answers, but providing other ways that practitioners can do it.
I think that's wonderful. And I think that venues like this,
Yes.
A4M being the leadership of this, and we call it Redefining Medicine now, because it's time to redefine medicine, and it's time to change the way we're practicing medicine.
Absolutely.
Because the kids need it, and the adults need it. And thank you so much for helping clarify and help with children, because they're the future.
Yeah.
Thank you, Doctor.
Thank you, Erica.
Thank you so much.
Yeah, it's great to be
It's a
here.
pleasure.